STORK is so unique in its training and education that it applies to literally everyone. A physician, a nurse practitioner, an EMT paramedic, a flight care nurse, everyone can benefit from the education provided in STORK.
I think one of the great things about STORK is that it's beneficial to all levels of professional training. While in that class, we interacted with physicians of similar training, physicians of higher training, but also like EMS, pre-hospital, and nurses. So I think really across the board, everybody benefits from STORK, no matter where they take care of people, whether it's in a hospital or out in the field.
STORK is structured in about a 5-hour-long program, 4.5 to 5 hours. We have about 2 hours of lecture, and then after that, it's 4 simulations. So we have high-fidelity simulators. Rhonda and Victoria are our 2 maternal simulators, and we have several neonatal and infant simulators. The simulations take the practitioners and participants through the material that is covered in the lecture and the didactic portion. So we cover hypertensive disorders, we cover the basics of physiology, we cover how to treat a postpartum hemorrhage, we talk about an emergency delivery and the immediate newborn resuscitation. STORK was designed to create an educational focus that would hope to bridge a gap in education, a gap in training. We've had critical healthcare site closures, again, across the state that have created another layer of barrier for patients to get access to care. Anyone can have a complication with the delivery, and so training these people to understand how to recognize and prevent obstetric emergencies is key to improving further morbidity and mortality. We've trained over 950 people and we've performed 62 classes, and we are going strong. We targeted the initial areas on the map that were designated the maternity care deserts.
One of the best things I think about STORK is I've taken it 3 years as a resident physician, but it's not just for doctors, it's just not for people who take care of patients in a hospital. It's great for every level of healthcare training, from basic EMTs all the way up until you're a physician in a hospital practicing. I think there's something for everybody, and there's great resources for everybody that they can use as well to care for those patients.